Thank you for joining us and good afternoon. My name is Maria Rudicelli and today we'll be presenting a conscious response, the effect of gender policies on a COVID-19 response.
I'm Sarah Gaines and I'm a junior.
I'm Kaylin Roop and I'm a senior.
And I'm Anna Lauer and I'm also a senior.
To first determine if there is any basis to our hypothesis and if there is any need for a gender-based response, we first looked at several past viruses and outbreaks. We found that women were disproportionately affected by many of these outbreaks, and upon closer inspection, we determined that gender and its corresponding societal roles were to blame for these disparities as opposed to a biological difference in sex. During the Ebola and Zika outbreaks, women and girls were disproportionately affected due to their gender roles. Most women are not employed in paid care work and instead are tasked with unpaid care work, which puts them at higher risk of infection with little to no health care. Pregnancy also puts women at an increased risk. During the SARS outbreak, cultural and gender norms valuing men more than women were to blame for the disparity. Preference for sons is so prevalent that it leads to sex-selective abortions, as well as neglect, a lack of nutrition, and lack of vaccination for female children. These factors all lead to a decrease in immune response in the women and girls of these regions, and it leaves them far more vulnerable to diseases. During the 2009 swine flu or H1n1 outbreak, those who work in healthcare, education, or have frequent contact with young children are more at risk. Incidentally, these are all positions primarily held by women. During the outbreak, women were far more likely than adult men to be hospitalized or die, although age was also an important factor. Although a variety of variables are at play, it is clear from examining various past viruses and outbreaks that there is a clear trend of women being disproportionately affected. If we wish to change this, gender-sensitive policies are necessary to combat these biases.
For our research, we hypothesized that if a country possesses any type of gendered policy, they will have a better overall COVID-19 response. We will measure this by standardizing by population the total number of COVID-19 cases per country. Given this statement, you're probably wondering what constitutes a gender-sensitive policy. According to the United Nations Development Program, gender-sensitive policies are defined as those that seek to directly address the risks and challenges that women and girls face during the COVID-19 crisis, notably violence against women and girls, unpaid care work, and economic insecurity. We believe that investigating the relationship between gender-sensitive policies and successful COVID-19 responses is important because women are disproportionately affected on a social and psychological level by the pandemic. Women are more likely to work as essential workers and caretakers than men, which places them at a risk of contracting the virus. Not only are women physically threatened by the virus, they are also threatened in the form of declining health, education, economic, and agency conditions. For example, reproductive and sexual health care has been placed on the back burner as governments and hospitals dedicate their resources to assisting the infected. In fact, studies from Kenya and the UK indicate that the number of forensic medical examinations that are offered to women after sexual assaults have decreased. Additionally, the number of cases regarding assaults that are being heard in the courts have decreased. As schools close due to the pandemic, women and girls are more likely to quit attending school in order to provide care for their siblings or children. Women are also more likely to quit their jobs in order to provide for their families during the pandemic. Some women in countries that experience food scarcity, women may be required to quit eating extra food so that way the men and their families can eat comfortably. Finally, more time at home has increased the number of domestic violence claims, which reduces women's self-autonomy. A final consequence of COVID-19 for women is the psychological effect that it has on their mental state. Studies from the Kaiser Family Foundation have indicated that 12% more women than men experience or are fearful of income loss due to the pandemic, 12% more worried about getting sick, 8% more worried about being able to afford care, and 9% more concerned about how the coronavirus has affected their mental health. Additionally, a study from Wuhan, China has indicated that 7% more women experience post-traumatic stress syndrome as a result of the pandemic than men.
To determine if our hypothesis is statistically significant, we are using data pulled from the United Nations Development Program, Our World in Data, Varieties of Democracy, and the World Bank. For our controls, we are controlling for swine flu infection, death rates, hospital beds per capita to determine the strength of the health system to handle a pandemic, GDP, deaths per obesity, blood pressure, smoking, asthma, and the population over 65, and the regime type of each country. The purpose of these controls is to remove all possible outside variables that can skew how gender policies affect a country's COVID response. Our independent variables, we have included variables that address how economic protections, labor protections, violence against women protections, and unpaid care protections to determine how many gender-sensitive policies each country has. When considering if each country has policies that protected women, the policy must be gender-sensitive, not a broad policy that covers both men and women. For our dependent variables, we are determining how well each country has responded to COVID by using each country's infection and death rate per million, which has been pulled from Our World in Data. We have not fully run the regression on our data set, but after all regressions have been run, we will continue to look for variables that could affect the results to make sure that the results are as accurate as possible.
As Sarah said, we have yet to achieve our expected results, but by looking at our statistical data and taking into consideration all of the controls that could also affect women during the pandemic, we are confident that we will be able to prove a 95% confidence level that having gendered policies does indeed result in having a better response to COVID-19 overall. Here are our works cited and our citations for our project thus far, and any questions?